The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. And very interesting program as we move forward today, but I want to kind of reset it by simply saying this to you. The topic we're going to talk about is one that has been around since 1947, 46, and it was used for other than medical technology. And what we're talking about is thermographic imaging, thermography. Now, thermography has been known in Europe forever relative to its medical applications. We're finally getting up to speed in the United States over the last several years, and meaning probably 20, 30 years. And we're really understanding its intimate diagnostic quality. So let's talk about what thermographic imaging really is. Thermographic imaging is measuring, taking a camera and taking a picture of a heat signal of anything. In this situation, we're talking about a heat signal of the body. So your body has vascular bed, it has an energetic platform and expresses heat. Blood supply is measured in many different ways, hot and cold. You have a body temperature of, on average, 98.6. Some of it's normally a little lower, some of it's normally a little bit higher. But it can be measured. We can measure that with a thermometer. How about, mom's takes her hand and puts it on your cheekbone and say, oh, you're hot today, or on your forehead and say, you're hot today. So she's using thermosensors in her skin to determine and differentiate between hot and cold. Now, when it comes to you, you can do that yourself, but sometimes you're going to be in error. Somebody else can do it to you, and it could be an error too. But what if we could have an accurate diagnostic platform that would measure it, and not only measure it relative to its intensity, but be able to demonstrate it and look at it? That's called thermography. There's a company, Thermographic Imaging, or Thermography Centers, if you will, of Fairfax and Thermography Centers of Virginia, and I'm part of that organization. But our primary principal, who is amazing at taking these images, is someone called Dareth Painter, and she'll be on the program within the next couple of weeks or so, maybe more than once, and she'll really give you an insight. But I want to get into what it really is and how it works and why it's so important to use it as part of your ongoing healthcare examination. So thermography, number one, is the ability to take a picture of a heat signal in your body. In the area of a thyroiditis, means an inflammatory reaction of the thyroid, you can see it on a thermographic imaging. In problem with congestion of the lymphatic system, the lymph system can get hot. You can see that with thermographic imaging. Now, one of the ways it was introduced in the United States and had been used in Europe as a primary investigative tool was a substitution, if you will, for what? For mammography. It's these radiation, these CAT scans that take soft breast tissue, squishes them with about 45 pounds, and then irradiates it. Do you think that's not an ongoing irritation to that soft breast tissue? Well, the truth of it is, and we'll get into it, over the next few weeks, how thermographic imaging is non-invasive, how it has no accumulation, and it has a higher diagnostic quality done properly than mammography does. Matter of fact, if you've had several mammographies in a row, like 4 or 5, you increase your risk of breast cancer by about 40%. And you can look it up, go to PubMed, go to the Townsend Letter, go to Nature magazine and so forth, and look up the data that I'm talking about, and you're going to find that it's really valid and it's something that you do. So here's the deal. Wouldn't you like to know if something was starting? And what do I mean by that? Wouldn't you like to be able to identify a tumor, a lesion that was developing well in advance of its development? So you get a little breast tumor. Your doc says, yeah, we got something there. They go in and they do what? They do a biopsy. And they say, well, you have cancer. Well, that cancer just didn't start the day that you felt the little lump. That cancer didn't start when the doctor decided to take the biopsy. It's been growing for quite some time. And in today's world, when we're hearing all these things about turbo cancers and so forth, and breast cancer is becoming exponential, since when? Since COVID, since the vaccines and so forth. Another topic we can explore at some time. But here's the deal. We're seeing more of them. And they seem to just expand rapidly. Well, my opinion is that these underlying cancers were already beginning to evolve. And had we known about them, you knew about them, your doctor knew about them in the early stages, then you could begin to do something proactively long before they became so aggressive and so metastatic. So if we have a little tumor that develops, it has to have a blood supply. And that blood supply will develop anywhere from 3 to 8 years before the tumor expresses itself. So you don't have the tumor, you don't have the cancer, but their body is starting to develop a feeding system because it's irritated. It has to do some damage control. So it puts the blood supply in. So if the blood supply is there and you can see it change compared to one side over the other, you know you may have a problem. And then you do an ultrasound and you do an MRI. Now you're ahead of the game and you could do something much more proactively. But thermography has the ability to show situations that yet have not been identified in other forms of diagnostics, blood work, and other things of that nature. So let's say, for example, that you take a picture of the neck with a thermographic instrument. It's a camera, and it's not invasive. It doesn't hurt you. But all of a sudden, we see this hot red area that is really sticking itself out there as compared to the side, or perhaps both sides. What might that suggest? That may suggest that you have cardiac or cardiovascular problems or carotid artery plaquing. This is the carotid artery. It comes off the heart and goes up and feeds the brain. And there's a lot of people that end up with very significant plaquing of that arterial system. Wouldn't it be nice to find out if that's why you were getting head pain, dizziness, all kinds of abnormal situations, syncope patterns, or even memory loss? Maybe the development of what they said was old age, dementia, or even the beginning stages of Alzheimer's. If that's the case, and you knew it was there, and you could do something about it, now's the time to act. Well, thermographic imaging may give you that extra leg up to see if there's something that you have to react to, do something about. Now, we use it often for pain anywhere in the body, joint pain, shoulder pain, hand pain, neck, head pain, and so forth. So we take an image of the area and we see that there is inflammation. There's a hot red area there. And as compared to the other side, it's not there. That tells me, yeah, there's where the problem is. But what happens if I take an image of the shoulder and it's mildly irritated, but the problem is coming from that portion of the neck? I can see it better there than I can see it on X-ray. Now, that will give me a leg up, and it also will give me the capacity to be able to do other things diagnostically to confirm what I just saw without invasive anything, and then take the action steps that we need to. So, we're doing a very important diagnostic piece, and we do it through the Roselle Center for Healing in Fairfax, and other docs that we associate with. We let them use the skill sets and so forth. But if you had that tool and you knew what steps to take, and it was not invasive, and it was one that gave you the right therapies at the right time, wouldn't that be great? I think so. Listen, coming up in September, very, very shortly, we're going to be doing an in-house program, and we're going to be talking about seeing beyond the surface with thermographic imaging. is going to be on Wednesday, September the 17th at 6 p.m. Please join us. And, you'll get to meet Dareth Painter. She's the one that's going to lead this one. And she's going to show you how this can be used. She'll answer your questions. All you have to do is register. Call us at the office, 703-698-7117. Tell them that you want to register for the thermographic imaging seminar with Dareth Painter on the 17th, or simply go to drtomroselle.com or rosellecare.com and register and be our guest. We'll show you the camera. We'll show you images. We'll even take a couple pictures of somebody sitting around, or a volunteer that we already know about. And we may do a shoulder, we may do a head or neck and so forth. And you'll see what really is in front of you underneath the surface that you couldn't see with anything else. But when you look at somebody and they're just sitting there, how do you know they're in pain? Unless you take an x-ray. How do you know they're in pain? Unless you do an MRI. How do you know they're in pain? Unless you do a CAT scan and confirm that it's either there or it isn't. Well, you can do it with a thermographic camera. You can do it with thermographic imaging. It's a technology that has been around forever, and it's finally being embraced and looked at in the United States. But thermography can detect underlying inflammatory reactions and disease processes and so forth. If you have a rheumatoid pattern in your hands or rheumatoid patterns in your knees and your hips and so forth, it will show it. And you say, oh, I actually have this problem. It's not all in my head. So when you understand that there's a way to diagnose something far more accurately and better than a lot of the traditional diagnostics, get it done, learn about it, make a decision. And it's one that you don't need a doctor's order to get done for yourself. All you need to do is say, hey, can I come in and talk to you about thermography or what it is? And, it's amazing for the early diagnostic criteria for the prevention of disease processes. And so here's what the deal is. Diagnostic imaging through thermographic means can show things earlier, much more specifically than other technologies that are available. And it shows it right there. It's there on the camera. You can see the picture of it. It's there. Okay, now let's follow up with the right diagnostic tools. But Thermography Centers of Fairfax, they have the skill sets. Dareth is amazing. They're part of an outfit called the American College of, if you will, Clinical Thermology, and it's called ACCT. And there's a doctor who I have a tremendous amount of respect for. His name is Dr. Peter Leando. And he's the guy that put this company together. He was one of the stalwarts in this field for many years. And Dr. Peter has really put together a tremendous organization that we support, that we embrace. He's really, as a medical physician, cutting edge. And Thermography Centers of Fairfax, Thermography Centers of Virginia are part of that organization. And to really, truly understand the applications of this amazing technology, this amazing tool that has served so many people very well in the early detection and ultimately the prevention of different types of disease processes. So please join us in September on the 21st. We'd love to have you as our guest. We'll show you what thermographic imaging is all about. We'll show you how, the 17th, did I say the 21st? It's the 17th. But register for it today and join us. And we'll give you the Cook's tour. We'll show you exactly what's there. We'll show you exactly what the applications are. We'll answer your questions. I think you're going to be impressed. I think you're going to say, why didn't I know about this before? Or, yeah, somebody told me at one point, but I wasn't sure. But if you had this tool and you knew that it could be used preventatively as well as diagnostically, and it was accurate, and there was no mistakes that were made, and it was your body expressing it in a pictorial fashion, wouldn't that be amazing? I don't know about you, but it's one that I want to put my head around. So, and I use it, by the way, for my own health. Over the years, having played some really rough contact sports and having done all kinds of crazy hobbies like jumping out of perfectly good airplanes and martial arts and things of that nature, this whole body of mine has taken a few blows from time to time, and every once in a while they flare up, even though that I do everything I can to take care of them through good chiropractic care and acupuncture. And, I happen to have the best of the best. And I'm married to my nutritionist. So many of you know Sue. But here's the ability for you to take a proactive stance if something's happening. Ladies, if you are starting to breed something that you don't want there, guys, it'll show problems with you as well. And if you know that it's coming, you know that there's something, now you can do the correlative tests. And here's an example. You send out for a cancer marker, a CA, 17, and the cancer marker comes back borderline. But if you could match that with the thermographic image that says there's something there in that breast tissue, now you have a diagnosis that you can act on and dig a little deeper and be proactive and use many of the things that are out there that may help you. There are all kinds of things. And we've seen changes exponentially, rapidly, immediately. We've had physicians send us patients that they put on natural processes because they want to be able to follow, because they know that the thermographic pattern will show the progression in a positive way, as well as the progression in a negative way, so they can keep their thumbprint on it. So I promise you, we're going to show you how to use this. Register today because it's going to be a full house. Don't hesitate. Get it done. September the 17th. It's a Wednesday night, 6 p.m. at the Roselle Center for Healing in Fairfax. I promise you we'll answer all your questions. Dareth is a fountain full of data and information. She's excellent at what she does. And we kind of keep her under wraps. We don't let her out to play more than, with programs like this, more than on an occasional basis. So you'll have the opportunity to meet her, ask her questions, and really get down to the nitty gritty with your health and really what's going on. I had a patient the other day that had a problem with her tooth. And they went to the dentist. The dentist couldn't find anything. There's nothing there. So she came in and she said, would this show a problem if it's in the bone, if it's there? I said, yeah, it would probably show it. So we took thermographic imaging of one side and of the other side. And sure enough, in the bone, underneath the tooth, there was an inflammatory level that was hot like a poker. And we sent her back to the dentist and we said, you have to go in, and if you're not willing to go in and do cavitation injections, you got to send her to somebody that does, because this is going to drain into the wrong organ systems and cause all kinds of problems. So she did, and she went back and they said, okay, so they did a cone beam of the bone and they found, yeah, you're right, sitting right there, where a regular x-ray wouldn't show it. But the cone beam of the bone did. It was there. So she's fine today. But what showed it was the thermograph. But if she had listened to her dentist initially, and he wasn't a bad guy, he was using all the skill sets that he had in front of him to be able to help the patient, to diagnose it, to set it where it's supposed to be, but missed because it wasn't showing up under traditional diagnostics. So as we go on over the next few weeks, we're going to talk about this a little bit more. We're going to show you some applications, but we're also going to talk about some other interesting pieces of the puzzle as well. So make sure it's the 17th of September at the Roselle Center for Healing. We're going to be featuring Dareth Painter, and she'll be talking about thermographic imaging, and she'll be representing, obviously, the Thermography Centers of Fairfax and Thermography Centers of Virginia. So please join us, register today, and I promise you, you're going to go away with a ton of data. Remember, we do this ongoingly for one reason only. The data is important that you have to help your life, but more importantly, we respect and we love you all. You have a great day. Talk to you soon. Bye.